Every day, millions of people take metformin. But what if I told you many of them are taking it incorrectly? One wrong timing, one wrong food, one wrong combination. And this powerful diabetes medicine can suddenly cause stomach problems, sugar crashes, or dangerous spikes. Metformin is a life-changing drug, but only when taken the right way. In the next few minutes, I'll reveal the correct dose, the perfect timing, the foods you must avoid, and one surprising scientific fact about metformin that even many patients, and some doctors, still don't know. Metformin, or metformin hydrochloride, is one of the most trusted and widely used medicines for type 2 diabetes. It belongs to the biguanide class of anti-diabetic drugs and has been used safely for decades. You'll find it under brand names like glucophage, glycophage, Cetapin, Metlong, and Obimet. Doctors usually prescribe metformin for people with type 2 diabetes, high fasting sugar, insulin resistance, and for those who are overweight. In fact, for most patients, metformin is the first medicine recommended for long-term and stable blood sugar control. Here's something truly amazing about metformin, something most people have never heard. Research from around the world shows that metformin does much more than just control blood sugar. It may actually help the body live healthier for longer. Studies suggest that metformin can reduce inflammation, which is one of the major causes of aging and many long-term diseases. Even more interesting, some clinical research shows that metformin may lower the risk of certain types of cancer. Because of these powerful effects, scientists are now studying metformin as a possible anti-aging medicine. It works by activating AMPK, the body's master energy control switch. When AMPK turns on, your metabolism becomes more efficient, your cells stay protected, and your body functions in a healthier, more stable way. This makes metformin unique. It doesn't just control diabetes, it may also support overall metabolic health and long-term well-being. That's why many experts call metformin a medication that goes beyond diabetes. Metformin works in 3 major areas of the body. First, it acts on the liver. Here, it reduces the extra glucose that the liver normally produces, especially during fasting. Second, it works in the muscles. Metformin increases insulin sensitivity, which allows your muscles to use sugar more effectively and lowers blood sugar naturally. Third, it affects the intestines. It slightly reduces the amount of glucose your body absorbs from food, but the most interesting action happens deep inside the mitochondria, the cell's energy center. Metformin lowers ATP levels and increases AMP. This shift activates AMPK, the body's master energy control switch. Once AMPK is activated, the liver produces much less glucose, the body becomes more efficient at using sugar, and overall blood sugar levels start to drop. This powerful multi-level action is what makes metformin the first-choice medicine for type 2 diabetes. Even though metformin is known as a diabetes medicine, it is commonly used in PCOS because many women with PCOS have a condition called insulin resistance. It makes your body more sensitive to insulin, so less insulin is required. It reduces extra sugar release from the liver, preventing insulin spikes. Lower insulin helps reduce male hormone levels, improving hormonal balance. When insulin levels come down, your ovaries start functioning more normally. The usual starting dose of metformin is 500 milligrams per day. Based on your sugar levels, the dose may be gradually increased to 500 to 1,000 milligrams, taken once or twice daily. The maximum recommended dose is 2,000 milligrams per day. Metformin comes in 2 forms: immediate release, or IR, which is taken 2 to 3 times a day, and extended release, or ER, or sustained release, or SR, which is taken just once a day, usually at night after dinner. For children, the dosage is based entirely on body weight and must be decided by a doctor. Metformin should always be taken after food. This helps reduce stomach discomfort and prevents nausea, acidity, or bloating. Taking it on an empty stomach can make these side effects worse. For most people, immediate release. Metformin is taken twice or thrice a day, after breakfast, after lunch, and after dinner, as per doctor prescribed. The extended release, or ER version, or sustained release, or SR, is usually taken once daily, most commonly after dinner, because it stays in the body longer and is easier on the stomach. Always take your Metformin tablet with a full glass of water. Do not crush it, chew it, or break it, especially if you're taking the extended release version. These tablets are designed to release the medicine slowly, so they must be swallowed whole. And remember, taking Metformin with food helps your body tolerate it better. It reduces stomach-related side effects. Metformin can interact with a few important medicines, and knowing these interactions is very important for your safety. First, alcohol. Taking Metformin with alcohol can increase the risk of lactic acidosis, a rare but serious condition. Second, cimetidine, an acidity medicine. It can raise metformin levels in the blood and increase the chances of side effects. Third, steroids. These medicines can raise blood sugar, which may reduce the effectiveness of metformin. Fourth, diuretics or water tablets. They may put extra pressure on the kidneys, especially when combined with metformin. If you're taking any of these medicines, always inform your doctor before using metformin. Metformin has very few food interactions, but there are a few important points to remember. First, never take metformin on an empty stomach. This can increase nausea, acidity, and stomach discomfort. Second, avoid alcohol completely. Alcohol and metformin together can increase the risk of lactic acidosis. Milk, tea, and coffee are generally safe. Just keep in mind that coffee on an empty stomach may worsen acidity. For the best results and the least side effects, always take metformin immediately after meals. Metformin is not suitable for everyone. People with severe kidney disease, severe liver disease, chronic alcohol use, or active heart failure should avoid this medicine unless specifically advised by a doctor. Metformin also needs to be temporarily stopped before and after certain medical procedures, especially CT scans that use contrast dye because it can put extra stress on the kidneys. And finally, if you are pregnant or breastfeeding, metformin should only be taken under strict medical supervision. If you ever miss a dose, don't panic. Take it as soon as you remember. But if your next scheduled dose is already near, just skip the missed one. Whatever you do, never double the dose. Taking 2 doses together can be harmful. Stay safe and follow your dosing schedule carefully. Store Metformin in a cool, dry place, away from direct sunlight. Always keep it out of reach of children. Avoid storing it in humid areas. Moisture can affect the medicine's quality. Diabetes is a long-term disease, so metformin is often used long-term unless a doctor decides otherwise. To summarize, metformin reduces sugar production in the liver, improves insulin sensitivity, and helps control blood sugar effectively. Take it at the right dose and the right time to get the best results. If you want videos on more medicines, comment below with the drug name.